This afternoon, the CDC reported its first case of a new and potentially deadly virus circulating in China. It's called a new coronavirus. The agency says a Washington state resident who returned last week from the outbreak's epicenter was hospitalized near Seattle. While China works to contain the new outbreak here in Texas, several agencies say they're working together to monitor it. Fox 7 Austin's Destiny Chance in studio with more on this tonight. Destiny.
Well, Mike, the outbreak started last month in central China. The AP released new information tonight. The virus has quickly infected 440 people in Asia and has killed 9 in China. Infected patients report having a cough, fever, and shortness of breath. Since the outbreak started, the virus has spread to Japan, Thailand, and South Korea, and now 1 person in the U.S. A new coronavirus has now evolved into human-to-human transmission.
Symptom-wise, it appears right now it's very much like other typical pneumonia types of illness, so respiratory types of situations. Pneumonia can become complicated, especially in immunocompromised patients.
Originated in Wuhan City, China, Tuesday the CDC confirmed its first U.S. case has been detected in Washington state. A man in his 30s was returning from traveling in China.
Everyone should care, right? So anytime there's a new virus or a new microbe, whatever that's going to be, we should certainly have our radar up and be aware of what's going on.
Dr. Rodney Rohde, chair and professor of clinical laboratory science at Texas State University, says since this is developing, there isn't a certain source of the coronavirus.
It's not like an Ebola. It's not like tuberculosis or flu, things that we are actually around all the time. So sometimes public health perspective is something we like to kind of help so that the general public doesn't panic.
This month, federal health officials started screening passengers arriving from China at airports JFK, San Francisco International, and LAX. Tuesday, the CDC expanded screenings to Atlanta's Hartsfield-Jackson International and Chicago's O'Hare International Airport.
And it's just something to keep in mind for perspective. Again, influenza is blowing up all over this country right now as well. Same type of fatality rate, and we're not testing everybody at airports. Does that make sense? So again, this is just new, so they're going to be very careful with, what that virus is until they kind of have that play out.
Shortly after the CDC's announcement Tuesday, the Texas Department of State Health Services said it's monitoring the situation closely and recommends anyone traveling to and from Wuhan stay informed and contact their healthcare provider to share their travel history if they experience symptoms. Austin Public Health sent Fox 7 Austin this statement saying it's coordinating with Texas DSHS and the CDC to prepare for any possible local cases of the Wuhan coronavirus. In the meantime, Dr. Rohde says when traveling, be very cautious of hand hygiene. Wash your hands with soap and water or rub them with an alcohol-based sanitizer.
Being around people that seem sick, are they coughing? Are they doing those sorts of things you might want to try to avoid? Those types of sick-looking people. Right now, we know we don't have a vaccine, so right now it's really more about prevention.
We called ABIA for a comment, but we haven't heard back yet. But the CDC says a team from its agency has been deployed to support the ongoing investigation in the state of Washington, including potentially tracing close contacts to determine if anyone else has become ill.